Hello there. Thank you and welcome. Thank you for participating in the internet today. And today's little chit chat will be about brain fog. Now, there's a real correlation between brain fog and those diagnosed with, say, AS or inflammatory arthritis of kinds like rheumatoid arthritis as well. And you're probably thinking, well, what is brain fog? I'll tell you. So, brain fog is where you have a lack of concentration, your brain kind of its cognitive ability or cognitive processes aren't up to the standard that they should be if you didn't have the chronic illness. So it happens a lot across chronic illnesses as well, not just rheumatoid arthritis and ankylosing spondylitis. And, common things associated with it will be, the ability to concentrate fully, the ability to learn new things, to think straight, think of new things, think of things when you need to, being put on a spot and your brain just doesn't work. And I've been asked before, oh, that sounds weird, but what do you do? Just get on with it? No. So your body is constantly in a kind of situation where it's constantly fighting against whatever illness you've got, hence autoimmune illness. That's what an autoimmune illness is. It attacks your own body. So while it's attacking that, it obviously sends certain signals to the brain to tell it to kind of say, I'm attacking something's not right, you've got to put this right. So while your brain's doing that, it's putting all of its mental power into a job that it's got to do, as in stop the autoimmune illness taking hold, because it doesn't understand it, it confuses it. So there's hardly any power left over to do what you would normally do for your job, hence the brain fog. That's where the brain fog sits. So let me give you an analogy. This is the best way of kind of thinking of it. If somebody got a hammer and started smashing your hand up, that's the sound of a hammer. And then they said, right, while I'm doing that, can you do this mathematical sum for me, please? And it's a formula of some kind, and you have to think about things, work this sum out while your hand's getting smashed to pieces. Can you do it? Probably not. Now, I would say that's probably, that's what it's like when you're in a flare-up, okay? So your brain has pretty much no capacity to do anything else, constantly thinking about the pain, and there's no capacity for brain function. Okay, so if your brain function is rated out of 10, you've got no pain, you've got 10, your brain function is rated up to 10. So you've got a score of 10 on your brain function, a score of 0 on your pain function. Now, if the pain is 5, and you've only got up to 10, your brain function has got to come down to 5, because 5 plus 5 equals, you're right, 10. So congratulations on the people that did that sum. That was a test to see if your brain fog was actually happening. Yes. Anyway, so as you can see, the higher the pain, the brain fog, or the brain capacity, the brain fog is higher, because your brain capacity to be able to do what you would normally do, decision making, ability to think straight, all those things get put to one side. How does it affect your life? Massively. Do not brush this under the carpet. This is something that you might think, oh, I get brain fog as well. It's huge. Fatigue is kind of like it kind of comes with it. It's kind of like I'd say it's like a side effect almost from it. For me anyway, I don't know how it works with you. So if I've got kind of brain fog, the fatigue is kind of like there as well. Or you could have fatigue and the brain fog comes with that, because your fatigue is high, your brain fog. There you go. It's always scores out of 10. If one's 5, the other's 5. You do. It all balances. You've got to have a balancey seesaw. So, what do you do about it? That is the $1 million question. So, in terms of the source of the problem is usually a pain of sorts, whether it's a flare-up or your chronic pain level that you've got, going on all the time. The ideal situation is, just reduce that, do a yoga. But it's not always possible. So sometimes you just got to kind of ride out the brain fog. It will affect you in terms of day-to-day living, your job, your kids, everything. It can be debilitating in itself. It's tough. Also, actually, I just want to do a, kind of side little mention. A lot of medication can cause brain fog as well. So, on one side of things, we go, okay, I'm in pain. I want to reduce the pain so I can reduce the brain fog as well. That would be great. Okay, here's some pills. Take these. Your pain will come down. Brilliant. Your pain has come down. But guess what? Side effect of those pills is brain fog. Yay! So not all of them are like that, I'll grant you, but there are a few. So it's a really difficult balance to get it right. If you do get it right, brilliant, absolutely brilliant. It does take a while to balance things. Some people are, sort of anti-opioids for obvious reason. Some people are, or don't have the luxury of, say, biologic medication, which that's a shame that isn't available sort of worldwide for everybody, and not, let's say, insurance based in certain countries, which is, a real shame. But there we go. So, do you get brain fog? What do you do about it? Do you just ride it out? Is there something that you take for it? Other than, no illegal substances, obviously. Is it coffee, caffeine? What do you do? Let me know as usual. And until next time, farewell.